Hi, hello everyone. Welcome to FMGE Spotlight Must Know MCQs. Yes, audio video is it clear? Hello everyone. Am I audible? Okay. Let's discuss some important topics that is very commonly asked in your exam, especially FMGE exam, like hanging, drowning, asphyxia, postmortem staining, rigor mortis. All these are very commonly asked topics. Let's discuss some 25 to 30 important topics commonly asked in your exam. Let's start with the question number 1. You need to answer the each question. At the end, we'll have discussion about the explanation. The question number 1. The question number 1 is related to hanging. Following finding in ante-mortem hanging is known as. Hanging, very important topic that comes under asphyxial death. There are 4 important topics important in your exam. One is hanging, strangulation, suffocation and drowning. Following is the finding in ante-mortem hanging. Ante-mortem. What do you mean by ante-mortem? Ante-mortem means the person was alive. The victim was alive at the time of incident or at the time of hanging. So there is a picture given to you. In the picture, what we can see here, one eye is open, other eye is closed on the same side of knot. On the same side of knot, the pupil is more dilated and eye remains open. This is very important finding seen in around 30 to 40% cases of ante-mortem hanging. So options are Simmons sign, Amsus sign, lay face is sympathetic, Hangman's sign. Can you try? Can you answer? So the answer is lay face is sympathetic. Lay face is sympathetic. This is the finding seen in case of ante-mortem hanging because of pressure over cervical sympathetic chain, because of the ligature or because of the knot. The answer is C. C is the correct answer. What is Simmons sign? Simmons sign, it is a finding in case of hanging. It is a non-specific finding characterized by bleeding at intervertebral disc of thoracolumbar vertebra. So Simmons sign is not the answer. Hangman sign. What is Hangman sign? Also known as Hangman fracture, is common in judicial hanging. Judicial hanging characterized by fracture of C2, C3 and C4. The Hangman fracture involves C2, common in judicial hanging. That can be asked in your exam. What is Amsus sign? Amsus sign is transverse tear in the carotid artery. For example, this is the carotid artery. Carotid artery. In carotid artery, you will see transverse tear. That finding in case of hanging is known as Amsus sign. That is seen in judicial hanging. is seen in judicial hanging. So this can be asked in your exam. Here one more very important MCQ. Surest sign of ante-mortem hanging is. What is the answer? The surest sign of ante-mortem hanging. Your answer should be dribbling of saliva at the angle of mouth. So salivary glands are stimulated either because of the ligature, the pressure over the nerve ending because of the ligature, can be dribbling of saliva, which is the surest sign of ante-mortem hanging. The same question, surest sign of ante-mortem burn injury, your answer should be tooth particles in the respiratory tract, especially trachea and the bronchiole. Surest sign of ante-mortem drowning, very commonly asked. Your answer should be cadaveric spasm with aquatic plants in the hand. So this can be asked in your exam. One more important, that is difference between hanging and strangulation. The appearance of ligature in case of hanging and in case of strangulation. This is very commonly asked topic. Strangulation means ligature strangulation. Here. In hanging, ligature is oblique. This is a MCQ, very important MCQ. Oblique in nature. It goes like this, oblique in. But in case of strangulation, it is transverse. Transverse it is. Completely encircle the neck in case of ligature strangulation. Continuity. When you see the continuity of the ligature, hanging, it is non-continuous. Non-continuous. It is usually absent at the site of knot. But in strangulation, it is continuous, completely encircles the neck. Then, when you see the level in the neck, in hanging, it is above thyroid cartilage or above Adam's apple. But in case of strangulation, it is at or below thyroid cartilage. This is asked in your exam. And one more point, the base. When you see the base of the ligature in case of hanging, it is pale, hard and parchment-like. It's a pale, hard and parchment-like, soft and reddish in case of strangulation. All these are very commonly asked topics in your exam. Again, we'll repeat. In hanging, ligature mark is oblique, non-continuous, above the level of thyroid cartilage. It is pale, hard and parchment-like. Strangulation, it is transverse, continuous, at or below thyroid, soft and reddish. Look at this. This is the video that is showing ligature in case of hanging and ligature in case of strangulation. So this is the ligature. What you can see here is the wire which is used as a ligature here for demonstration, and the victim like demonstration here. You can see here in hanging it is oblique, so it goes upwards, oblique in nature, and it is incomplete. It is above the level of thyroid cartilage. But in case of strangulation, look at this. This is strangulation, which I am showing here. This is strangulation. In strangulation, it completely encircles the neck and it is transverse. There will be soft and reddish, multiple hemorrhages, bleeding at the site of ligature mark. So this is very commonly asked topic in your exam. And here one year the question was asked, in partial hanging, what is the appearance of ligature mark? In partial hanging, the ligature mark can be transverse. Okay. Second question. A sample has been evaluated. A sample has been evaluated. Following observation is noted under the microscopy. Identify the test demonstrated. What is the finding here? This question is about sample. The sample, probably it is blood sample that is given here. Blood sample that is showing brown rhombic crystals. What you can see here, brown rhombic crystal. And what is the test that is demonstrated? Options are Barberio test, Teichmann test, Takayama test, Benzidine test. Can you answer? Can you answer? Dhananjay Kumar, Music Mantra, Sushant Saptapati, Subhadeep. Can you answer this? Try, you can interact with me. Yes, come on, come on. Brown rhombic crystals. Waiting. Yeah. See, Barberio test. Barberio test is the test for seminal stain. Not the answer. Benzidine test, it is a test for blood stain. The color will be blue color. It is a screening test. Not the answer. So either it can be Teichmann test or it is Takayama test. Yes. So the answer is, whenever question asked brown rhombic crystals, the answer should be Teichmann test. The answer is Teichmann is the correct answer. You can remember Teichmann, or you can say a man word is there. You can remember a brown man. So in Teichmann test, there are brown rhombic crystals are there. It is a Hamming crystal test. In Takayama test, there will be pink feathery crystals. So the answer is B is the correct answer. Let's see what are the important questions that can be framed from blood stain. Blood stain, one very commonly asked topic in your exam. So how to identify blood stain in crime scene? Whether it is a blood stain or it is a beetroot stain or it is some vegetable, vegetable stain. So that can be identified by either by screening test or by confirmatory test. Screening tests are those, they have very high sensitivity but specificity is very low. So what are the screening tests? Screening tests are Benzidine test, phenolphthalein test, tetramethylbenzidine test, luminol test, 𝐒𝐿𝐴 green test, and orthotolidine test. So what are the screening tests? All is a screening test. The principle is the hemoglobin present in the blood stain that has peroxidase activity. So that peroxidase acts on hydrogen peroxide. It changes the color of the reagent. So let's see what is the color of benzidine. The benzidine color is blue color. So when benzidine reagent is used in identifying blood stain, the color is blue color, and this test is not used nowadays. Not used. Why? Because benzidine causes bladder cancer. That's why it is not used. Phenolphthalein, one of the common tests, also known as 𝐂𝐝 test. 𝐂𝐝 test, Kastle-Meyer test. The color will be pink color. This can be asked in your exam. Most common test for blood stain, your answer should be phenolphthalein test. Then tetramethylbenzidine, which is a derivative of benzidine. which is non-carcinogenic, that is also can be used. The color is blue color. Luminol test. This is asked once in your exam. Luminol test. So what is the importance of luminol test? Can I answer? Sushant, Saptapati, Dhananjay Kumar, Subhadeep. Luminol test that is used for identifying blood stain. It can be used even in old washed blood stain. Old washed blood stain. Like in case of Nirbhaya case. Then 𝐒𝐿𝐂𝐈𝐀 green test, the reagent that gives rise to green color. Orthotoluene test that gives rise to blue color. So all the tests are screening tests. Sensitivity is very high, specificity is very low. Now we are discussing confirmatory test. What are the confirmatory tests for blood stain? Your answer should be Takayama test and Tieckmann test. Confirmatory test, Takayama test, Tieckmann test. Let me discuss principle. As you know, blood stain that contain hemoglobin. The hemoglobin, when combines with the reagent, it forms hemine crystals. The hemine crystals are observed under the microscope. That is the confirmatory finding in case of blood stain. Takayama, there will be pink feathery crystals. Pink feathery crystals. Tieckmann, brown rhombic crystals. And remember, brown man, pink mama. You can remember. Yama is there, no? Yama is mama, that is pink feathery crystals. And the one more test that can be asked in your exam, spectroscopic examination. If they ask you an exam, most important or most confirmatory test for blood stain, your answer should be spectroscopic examination. All these are very commonly asked. Most common test, phenolphthalein test, which is a screening test. Confirmatory test, there are three: Takayama, Tieckmann, and spectroscopic examination for blood stain. That completes the topic number 2. Now look at this crime scene photo, and in the crime scene photo, what we can see here, blood stain, probably blood stain is there, and the color is pink color. So what is the probable reagent used? Can I answer? The reagent used is here AM test, also known as phenolphthalein test. Look at this photo. Identify what is the, this is luminol test. Okay, luminol reagent. The luminol reagent, when you apply, that gives us to luminescence, that is probably a blue color luminescence. It can be used in old washed blood stain also. So this is luminol test. Luminol test. Now let's see demonstration of Tieckmann test. So this is how we do Tieckmann test in the lab. You must take the suspected stain, make it the stain particles at the center. Then should add NaCl crystal and glacial acetic acid. And it should heat. Give rise to brown rhombic crystals. To observe under the microscope, what you can see here, brown rhombic crystals of the Tieckmann test. It's one of the confirmatory tests for blood stain. Next question. Which of the following is best to find out sex determination in a 12-year-old child. So the question is about identification, sex determination. Options are skull, hip, femur, mandible. Very simple. The answer would be pelvis is the correct answer. That is, hip is the correct answer here. The specificity is around 95%. Skull around 90%, femur around 80%, mandible around 75%. The answer is hip is the correct answer. Okay. Now let's see what are the differences between the male and female pelvis. Two important MCQ asked. One is about the greater sciatic knot. Greater sciatic knot. And preauricular sinus. Preauricular sulcus. These 2 points are very important. Greater sciatic knots in female hip bone, it is shallow and wide. Shallow and wide. In case of male pelvis, greater sciatic knot is deep and it is narrow. And the preauricular sulcus, which is prominent in female pelvic bone. Let's see about it. Look at this. Here is the A and B. The A is the female pelvic bone. B is the male pelvic bone. You can observe here greater sciatic notch. The greater sciatic notch is wide and shallow in case of female, deep and narrow in case of male. This is a very important finding in estimation of sex between, that is, male and female pelvis. And one more very important point you can see here in the picture, that is the preauricular sulcus. Preauricular sulcus, because of attachment of the sacral ligaments or McEnroe ligament, is prominent after childbirth in case of female pelvis, which is absent in case of male pelvis. So these two are very important topic, very commonly asked in your exam. You must know. Next question about the gunshot injuries. Gunshot injuries. The question is, a gunshot bullet showing tattooing. There is a tattooing. Tattooing means superficial wounds around the main entry wound. This is tattooing. Okay. This is tattooing. Tattooing is there. So tattooing is because of the unburnt gunpowder. Unburnt gunpowder. Inverted margin. As you know, most of the gunshot wound entry wounds are inverted margin. Everted margin in the exit wound. Okay. No signs of burn and charring. No signs of burning and singeing of the hair or charring. So that will rule out contact shot. Not contact shot. This is not close shot. This is not distant shot. Your answer should be near shot. The answer is near shot. The near shot in case of revolver and pistol characterized by tattooing. Tattooing is because of unburnt gunpowder. They are superficial entry wounds present around the main entry wound. Contact wound. What is the important finding? Anyone? What is the important finding in contact wound? In contact wound, you will see muzzle imprint. Muzzle imprint. Or cruciate or star-shaped entry wound. In close shot, you will see blackening. Blackening is a feature of close shot. The blackening is due to smoke particles because of the combustion of the gunpowder. Distant shot, there will be no tattooing, no burning, and also there will be no blackening. So there are 4-5 MCQ that can be framed in your exam. The MCQ number 1, muzzle imprint is seen in contact shot. Blackening is a feature of close shot. MCQ number 3, tattooing is a feature of near shot. Inverted margin seen in entry wound. Tattooing is because of unburnt gunpowder. Blackening is because of smoke particles. All these are repeatedly asked MCQs in your FMGE exam. Let's discuss the demonstration of firearm modes. So what you can see here in the picture, that is the pistol, and as you know, the pistol, that is a rifled weapon. Rifling means trains of lands and grooves. So this is in the video what you can see here, this is the contact shot. In contact shot, you will see muzzle imprint and inverted margin. There can be singeing of the hair, burning also. This is close shot. In close shot, you will see blackening around the entry wound. In near shot, you will see the tattooing when distance is more than around 9 to 60 centimeters. Distance end, there will be no blackening, no tattooing, and no singeing of the hair. This is very commonly asked topic, you must know. Next question. The most reliable criteria among Gustafson method is, options are root resorption, parodontosis, translucency of the root, attrition. Answer all of you. Answer. Try to answer. A, B, C, D. You type in the chat box. Type the chat box. Most reliable criteria. Gustafson method. Gustafson method is a method of age estimation after 25 years. It consists of 6 components. The 6 components can be remembered with the help of mnemonic script. So which is the best criteria? Yes, come on, answer. Yes, come on. Try. So answer for this question, very commonly asked. I'm just waiting for your answer. Answer is translucency of the root. This is the correct answer. Let's see some important MCQ that can be framed from Gustafson method. Yes, you are right. Age estimation by Gustafson method. Thank you. Yes, music mantra, good answer. Dr. Swapna, yes, C. Yeah. Age estimation by Gustafson components. The mnemonic is script. SCRIPT. Script is a mnemonic. There's one more mnemonic. APSRTC. AP, Andhra Pradesh SRTC. That also you can remember. Script is the mnemonic to remember components of methods, that is Gustafson method. What is S for? S for secondary dentin. Remember, it is not primary dentin. In exam, they'll give you primary dentin. It is secondary dentin. Secondary dentin means deposition of calcium in the root cavity. The size of the root cavity decreases. Second, cementum opposition. C for cementum opposition. Cementum opposition means incremental lines. When you observe the teeth under the microscope, you will see incremental lines. By counting the number of incremental line, you can estimate the age of the person under microscopy. That is cementum opposition. Next, root resorption. Root resorption is a component. As you know, resorption is because of osteoclast. They lead to bone resorption. Attrition. Attrition in Gustafson method, remember, it is wear and tear. One word answer, wear and tear. Wear and tear. Okay. What happens when age advances? There will be more and more wear and tear of the teeth. more is the attrition, more is the age. That is the inference. And P for periodontosis or parodontosis. When age advances, there will be loosening of the teeth. That is known as periodontosis, loosening of the teeth. T for transparency of root or the translucency of the root. So, anterior tooth are commonly used. So, this method is very useful in estimating age of the skeleton. When skeleton is found in crime scene, the estimation of age can be made with the help of the teeth, that is anterior teeth, like incisor and canine, not the molars. So, this method is Gustafson method. The best criteria, transparency of the root. Second best criteria, remember, answer should be secondary dentin. Okay. Next question. Next question. So this is very commonly asked, especially teeth formulae and estimation of age with the help of teeth and numbering of the teeth, and all very commonly asked. You must revise all those topics we discussed in our classes. Next question. Sixth question. You need to answer. Barberio test used for identification of which of the following? Barberio test. In Barberio, you will see yellow needle-shaped crystal. Options are CSF, feces, semen, and the blood. Answer: Barberio test. Barberio test for. Try everybody. Right? So Barberio test is for semen is the correct answer. Okay. Now let's discuss about test for seminal stain. Test for seminal stain, very commonly asked topic in your exam. The mnemonic is A, B, C, D, E, F, G. Okay. Seminal stain. A for acid phosphatase. As you know, acid phosphatase is the enzyme rich in seminal secretion. Estimation of levels of acid phosphatase is useful in identifying seminal stain. Or ammonium molybdenate test, which detects phosphorus. Okay. A for acid phosphatase or ammonium molybdenate test. B for, think B for Barberio test. Barberio test. Barberio, you will see yellow needle shaped crystals of spermine picrate. Every word is important here. Yellow, like this. Like this it is. Yellow needle shaped crystals of spermine picrate in case of Barberio test. Then C for creatinine phosphokinase test, or one more C, that is Christmas tree staining of spermatozoa, one of the confirmatory test. One of the confirmatory test. So when you see the spermatic head in the stain or spermatozoa by using Christmas staining, that is a confirmatory test for seminal stain. D for dry semen, especially in case of sexual assault, the victim body, so that they can be identified with the help of UV rays. Okay, UV rays. And D for dehydrogenase, that is lactate dehydrogenase test, LDH. So lactate dehydrogenase is the enzyme that is rich in semen. That is one of the specific enzyme that is present in the seminal stain. E for ELISA test. F for Florence test. Florence, very commonly asked. In Florence, you will see brown rhombic crystals. Brown rhombic crystals. Like this. And G for glycoprotein P30 test. Glycoprotein P30 test is one of the commonly used tests for seminal estimation or identification. So this is the topic very commonly asked in your ABCDEFGH. Remember, there can be many MCQ like Barbour test. What is the finding? Yellow needle shaped crystal. Florence test. What is the finding? Brown rhombic crystals. Most specific enzyme, lactate dehydrogenase enzyme. Most confirmatory, spermatic head of spermatozoa on Christmas stain. So blood stain, seminal stain, one very commonly as topic in your exam. Next question, 7th. Identical twins have similarities in all the following except. Identical twins, you know that there is a beautiful picture showing identical twins. Identical twins. Identical twins all are similar except is the question. Options are blood group, DNA fingerprinting, iris color. What is the answer? Right. Yes, Swapna, Music Mantra, Dhananjay Kumar, Deepak, Subhadeep. Right. Blood group can be same, not the answer. Iris color can be same, not the answer. DNA fingerprinting. What is the principle of DNA fingerprinting? VNTR. What is VNTR? Variable number tandem repeats. That is the principle of DNA fingerprinting. Fingerprint is the correct answer. Answer is fingerprint pattern is the correct answer, also known as dactylography. Dactylography is the correct answer. That is C is the correct answer for this question. Next, let's see about fingerprinting. This is very commonly asked in your exam. Fingerprinting, dactylography. What is dactylography? Dactylography means fingerprint system. That is identification of the person with the help of fingerprints. In a suspected crime or in accused, so the police people, they take usually fingerprint of all the fingers. In civil cases, only the thumb, usually left thumb is taken. It is the most reliable method of identification. This can be MCQ. Fingerprint Bureau was first started in India, MCQ, in Kolkata by Francis Galton as well as William Herschel. Galton system, it is also known as Galton system, fingerprint system, or dermatoglypics. Complete formation, when it is going to form, your answer should be 24 weeks. In 24 weeks of intrauterine life, it is completely formed. Proof of identity, your answer should be 12 points. When you are comparing between the two fingerprint, so the proof of identity usually 12 points according to Locard. There are 4 types of fingerprint: the loop, oval, arch, and composite. Very commonly asked in your exam. The picture you can see here, ABC. Identify ABC. A we can see here, the entry point and exit point on the same side. That is known as loop. When you see circle, that is known as oval. When you see arches, like entry and exit point on the different side, that is known as arch. So there are some MCQ. Let's discuss about it. The first one, that is the loop. The second one, that is oval. Third one, that is the arch. Fourth one, that is the composite. Let's see important MCQ. Loop is the most common one. Most common fingerprint, loop is the answer. Loop has one delta, one core. It has one delta, one core. Can be asked in your exam. Delta means 3 directional meeting point. Core means curving ridge. You can see here whenever you see one core and one delta, that is loop is the answer. What do you mean by core? Curving ridge. What do you mean by delta? Three-dimensional or the three-directional meeting point. Loop is the most common one. In simple word, loop is the one which has entry point and exit point on the same side. Like this, the same side. Second is the hole. The hole is having central circle, 360 degree circle. It has two delta. How many delta? Two delta. Around 20 to 25% of the case. Around 60% of the case. Loop is 60%. The arch means like this. This is the arch. In arch, there is no delta. There is no core. The arch is present around 10 to 15% of the case. The last one is composite. The composite means mixed. Mixed. Other than the basic arch. Around 1 to 2%. So there are 3-4 MCQ that can be framed. Most common fingerprint loop. The fingerprint shows 360 degree circle hole. One core, one delta loop. Two delta, that is hole. Arch, no delta, no core. Fingerprints are formed in intrauterine life around 24 weeks. Comparing points around 12 points. So all these are very common. Now there are some conditions where there is a permanent loss of fingerprint. What are the 4 conditions? One is the leprosy, radiation injury, electric injury. One more is skin grafting. So there are some conditions, there is a permanent loss. But in burn cases, there is no permanent loss. There can be temporary, there can be partial loss. One more MCQ that can be asked about the poroscopy. What is poroscopy? Question asked in your exam. Poroscopy. Poroscopy means study of pores at the fingerprint. It is first explained by Lockhart. The size of the pores, shape of the pores, distance between the two pores, that is the feature of particular fingerprint. That is used in case of crime investigation when partial fingerprints are available. This can be asked in your exam. Yes, I make out now ABC. What is this? A and a B and a C. ABC. So ABC that shows loop, hole and the arch. And there's one more picture that is showing microscopic finding that shows the pores, that is known as poroscopy. And see here, pores are there here. Size of the pore, number of pores, shape of the pore, distance between the two pores. So this is the very important finding in crime scene investigation when partial fingerprints are available. Next question. Rigor mortis occurs first in. Try this. Try this. All. Can you try? Yes, come on. Yes, music mantra, Sushant Saptapati, Dhananjay Kumar. Rigor mortis occurs first in. First in. What do you mean by rigor mortis? Rigor mortis means shortening and stiffening of the Magellan joint because of ATP depletion. So options are eyelids, intestine, myocardium, neck. What is rigor mortis? Shortening and stiffening. Because of ATP depletion. Asked in your exam. ATP depletion. What is the answer? So rigor mortis can happen in voluntary muscle also, involuntary muscle also. The first involuntary muscle, that is the myocardium, is the correct. Myocardium or the heart or the left side of the heart is the first site of rigor mortis in case of post-mortem examination or the post-mortem finding appearance. There is a rule known as NExT rule, very commonly asked in your exam. NExT rule. The NExT rule is a rule of appearance of rigor mortis. What is NExT rule? Rigor mortis first appears in the heart, left side of heart. Then it appears in the eyelids around 3 to 4 hours. Neck and lower jaw after around say 4 to 5 hours. Face is around 4 to 6 hours. Then chest, upper limbs around 7 to 9 hours. Then abdomen, then lower limb. Lastly, fingers and toes. So the first muscle, heart. Last muscle, fingers and toes. These two are very important MCQs. Opening batsman is heart. Last batsman, fingers and toes. This is NExT law. Remember, in the same way it disappears. First disappears in the heart, then from the eyelids, then neck, face, chest, upper limb, abdomen, lower limb and fingers and toes. This rule of order of appearance and disappearance is known as NExT rule. Now there is one more rule you must know, rule of 12. Rule of 12. Rule of 12. The rule of 12 is rigor mortis appears in 12 hours, maintained for 12 hours, disappears in 12 hours. Rule of 12. One more rule, Shapiro rule. What is Shapiro rule? Proximo-distal progression of the rigor mortis is known as Shapiro rule. It first occurs in the proximal muscle like biceps and triceps, then occurs in the forearm muscle, then occurs in the fingers and the toes. This rule, Shapiro rule, all are MCQs very commonly. Rigor mortis differential diagnosis very commonly asked, like case stiffening, cold stiffening, gas stiffening, cadaveric spasm. Must know the difference between cadaveric spasm and rigor mortis. And rigor mortis also known as acid rigor because of the increased levels of lactic acid in development of the rigor mortis. Cadaveric spasm is known as alkaline rigor. Cadaveric spasm is also known as cataleptic rigidity. So rigor mortis is some very important topic. You need to spend at least some 15 to 20 minutes to study all the postmortem changes and you need to revise. Next question. Question number 9. Which of the following is commonly used for preservation of viscera in toxicology during autopsy? So, preservation. Options are paraffin, rectified spirit, formalin, saturated salt solution. See, preservation of viscera is very important in toxicology, especially in case of poisoning. One very commonly used preservative, which is very cheap, around say 20 to 30 rupees per kg. So your answer should be saturated salt solution. Saturated salt solution, correct. Formalin is not the answer. Formalin is used in histopathology, not in toxicology. Rectified spirit, this is a best reagent, but because of it is costly in nature, rectified spirit is the best but not very commonly used. Paraffin is used in case of any specimen, suspected specimen that containing virus, for example COVID-19, rabies virus like. So what you can see here, some MCQs. In all the cases of poisoning, but acid poisoning, all the cases except acid, but including carbolic acid poison, that is preservative used is saturated salt solution. For acid poison, except carbolic acid, we use rectified spirit. For carbon monoxide poison, a layer of paraffin is used to prevent the escape of gas. In all the poisoning, including alcohol and also for the blood, potassium oxalate and sodium fluoride reagent. Sodium fluoride inhibits enolase enzyme. That is asked in your exam. This you must know. And what you can see here, 4 dabbas here, 4 containers you can see here. What are they? 4 containers. 4 containers. One is the stomach and stomach contents. The one containing stomach and contents of the stomach and intestine. This is the one that consists of liver, gallbladder and kidney. Blood, also that is the urine. And one more container will contain preservative that is used. There are 5 containers containing different viscera, including preservative during toxicology specimen. The most common reagent is saturated solution of sodium chloride. This you must know. Okay. Next, question number 10. And here we must know the incisions during postmortem: I-shaped incision, Y-shaped incision, modified Y, X-shaped incision, T-shaped incision. Also, you must know the techniques of autopsy: Letoulet technique, Virchow technique, Gaunt technique, Roquetansi technique. Question number 10, that is about the identification. Identification of person with the help of tattoo. Okay. A deceased male was brought to mortuary for postmortem examination. His relatives reported that he had a tattoo over his skin which was not found on examination. Tattoo was there, but tattoo was very faint. Faint tattoo can be identified with the help of infrared photography. Which of the following structure would you examine? Options are lymph node, liver, arteries and the skin. What is the answer? Let's try. What is the answer? Yes, the answer should be lymph node is the correct answer. Lymph node is the okay. Very simple it is. So lymph node that can examine any foreign body which is there. Tattoo is a foreign body that enters into the lymph node. So lymph node should be examined, not the liver, not the arteries, not the skin. Skin can be examined for injection mark. Injection mark. Liver is common viscera that is preserved, largest organ in the body. Arteries still not preserved. The answer is lymph node. See here, this is the tattoo. Very useful identification of the person. Also, some conditions like medical conditions like diabetic or rare blood group like Bombay blood group and all. In case of rape of a young child, the hymen is usually one very commonly asked topic in your exam: rape. You must know in and out of the sections, that is in case of 375, 376, and medico-legal examination of victim of rape, important. Medico-legal examination of accused of rape, important, very commonly asked. Sexual offences like unnatural sexual offences like sodomy, sexual perversions, commonly asked. So here the question is, in a young child, hymen is usually not ruptured. Why? Because it is deep-seated. Answer is unruptured because it is deeply situated. Hymen tear is a very important evidence in proving the crime, sexual assault or rape. Okay, but in case of young child, because the position is deep, it is unruptured. Let's see some MCQ related to this. Types of hymen. It can be annular hymen, concentric hymen, septate hymen, fibriform hymen, imbriated hymen. The annular hymen, there will be central opening. Central opening will be there. Crescentic hymen, which is the most common hymen, where hymen is situated anteriorly or posteriorly. Septate hymen, repeat question asked in your exam, there will be 2 openings. You see 2 openings, that is known as septate hymen. When you see multiple openings, that is known as fibriform hymen. When you see notches, that is known as fimbriated hymen. Fimbriated hymen resemble like torn hymen or artificial tail. Torn hymen. And for identification of hymen tail, we use an instrument that is known as Dicke rod. Can be asked. Dicke rod. Leicester-Keane rod. One more MCQ. Micro injuries over the hymen or the genitals use a solution known as Toluidine blue. Toluidine blue. All these are asked in your exam. In case of civil negligence against a doctor who bears the onus of the proof. Now the question is about negligence. Negligence can be two types: civil negligence, criminal negligence. Civil negligence is a non-gross negligence, minor negligence. Criminal negligence, gross negligence, characterized by gross absence of doctor's duty, absence of reasonable care and skill, leading to death of the person, leading to some serious injury to the patient. That is known as criminal negligence. Now here, civil negligence. Civil negligence. Civil negligence, what is the punishment? Punishment is compensation. Like example, Kunal Shah case, the compensation paid is around 11 crore. So the question is, in civil negligence, who has to prove the negligence? The answer should be patient. Patient is the correct answer. The same question asked, criminal negligence, the onus of proof, that is on the doctor. Criminal negligence, the gross negligence, onus of proof usually on the doctor. Doctor has to prove that he is innocent. He is innocent. Here, one very commonly asked question in your FMGE exam, res ipsa loquitur. What is res ipsa loquitur? Res ipsa loquitur is a fact speaks for themselves. Applicable for civil negligence as well as criminal negligence. Okay. So Anil Tanan, patient, yes, you are right. So look at this picture here. There is a picture that is showing a surgical instrument in the abdomen left behind after the surgery by some surgeon. The patient came with a history of fever, abdominal pain after a few weeks, a few months. So on X-ray examination, there is a surgical instrument which is there in the abdomen. So is this a civil negligence or criminal negligence? So this must be a criminal negligence. And in criminal negligence, doctor has to prove his innocence. Civil negligence, patient has to prove the negligence of the doctor. Very commonly asked in exam. Now one question about sexual perversions, sexual paraphilias. Sexual paraphilias. Discussing sexual paraphilias. Paraphilia. Abnormal sexual behavior. Persistent abnormal sexual behavior, usually of duration more than 6 months, is known as sexual paraphilia, or it is sexual perversions. There are many, like example, sadism, masochism, bondage, voyeurism, fetichism, exhibitionism. The question is about a guy was sitting on the balcony. He always used to sit nude on his balcony and derive sexual gratification by observing the people that look at him. This is best described as. The answer. Try this. It is not masochism. Masochism is taking pain from the partner, taking pain from the partner, whereas to sexual pleasure. Masochism. The opposite to sadism. Sadism means sexual perversion characterized by sexual pleasure obtained by beating the partner, can be associated with necrophilia, necrophagia, lust murder also, sadism. That is masochism, not the answer. Voyeurism. Voyeurism is in simple word known as peeping Tom, who has a habit of entering into the bedroom of others. Peeping Tom. Peeping Tom, punishable under 354 CIPC. CIPC. Peeping Tom is voyeurism. So it is not the answer. Fetichism. What is fetichism? Fetichism is sexual pleasure by looking at or by collecting feminine objects, example sari, petticoat, other feminine objects, that is known as fetichism. Inanimate objects. Fetichism means sexual pleasure with inanimate objects. Exhibitionism is the correct answer. Exhibitionism can be three types. Can be mooning, freaking. Yeah. Exhibitionism can be mooning, freaking, and it can be masturbation also. Okay. Answer is C is the correct answer. Next question, question number 14. The question number 14 is about recording of evidence. Very commonly asked topic. Recording of evidence like oath, direct examination, cross examination, re-examination, examination, or the court question. So here the question is about courtroom procedure. And this is about the courtroom procedure. Very commonly asked question. Courtroom procedure, also known as recording of evidence. Okay. While recording evidence in the court of law, the lawyer asks the witness, did A kill B in your presence? Get the question. Did A kill B in your presence? That means it is like a yes or no type of question. So answer either can be yes, yes I was there, no I was not there. So it is a yes or no type of question. Witness said yes. This type of question would be permitted in which procedural route in the court of law? The answer should be cross-examination. In cross-examination, leading questions are allowed. Okay, the answer is C, not the redirect examination, not the examination chief, not the direct examination. Best answer is cross-examination. Let's see some important points. Recording of evidence in a court of law. Very important topic. Recording of evidence in a court of law. Very interesting picture in the beginning. And you see there are three important characters in a court of law. Okay, taken from one of the movie. And you can see three characters. Three characters, what you can observe here. One character is the judge. Okay, judge means supreme. Can ask question at any time. Supreme, your honor. Supreme. And the other two characters, what I can tell you here is, say he is the defense lawyer. defense counsel, defense counsel, or defense advocate. We have one more known as public prosecutor, PP. Three characters, right? Now, what is the first step? First step would be oath. Oath. Okay. This is mandatory in all the eyewitness, direct witness, or expert witness. So usually, most of the eyewitnesses, oath is mandatory for all the witnesses. Under Section 51 IPC, and oath is not required in children. Usually, children means less than 12 years of age. Second, what is the second step? Second step, facts of the case. For example, murder case, rape case, any other case. So someone has to explain the facts of the case to the court, the judge or the magistrate. That is known as examination in chief by public prosecutor. Public prosecutor. Question can be asked. Leading questions are not allowed. Like yes or no type of question before, they are not allowed. Okay, and basically it is to explain the seriousness of the case or the facts of the case to the court. That is examination chief. Comes under 137 Indian Evidence Act. This can be asked in your exam. Next comes with the cross examination. Who is going to do the cross examination? The cross examination by the counsel of the defense, or the advocate or the counsel who try to protect or who try to prove that accused is innocent. So cross examination by defense counsel comes under 141 and 146 Indian Evidence. Leading questions are allowed. Second important MCQ, there is no time limit. Cross examination, no time limit. Next, re-examination. What is the purpose of cross examination? Cross examination usually to find out the inaccuracies present in the statement of the witness. Re-examination again by public prosecutor. Again, leading questions are not asked. Re-examination is to clear the doubts that originated during the examination, cross-examination. Lastly, court and judge question comes under 165, 311 CRPC. And court or the judge can ask the question anytime during the trial. There are 5 steps: oath, examination chief, cross-examination, re-examination, and lastly court. So this order also can be asked in the exam. What is the order of examination of recording of evidence? Question can be asked. Leading questions are allowed. Cross-examination. Here there is a tricky point. Leading question can be asked even in examination chief when witness says hostile witness. When witness is hostile, leading question can be asked by public prosecutor also during examination. All these are very important. There is no time limit for cross-examination. Now, very important question. Identify the type of wound from the image. So in the image, what you can see here, there are multiple abrasions are there, multiple cuts are there, bruises are there over the palmar surface or over the ventral surface of the forearm. Options are defense wound, antemortem wound, postmortem wound, hesitation cut. Let's go by one. Hesitation cuts, they are seen usually over the wrist. Over the wrist, they are commonly seen. A right-handed person over the left wrist. Left-handed person over the right wrist. They are seen in case of suicidal tendencies, borderline personality disorders, or any psychiatric illness with a tendency of suicide. You will see hesitation cuts. So not the answer. They are not the hesitation cuts. Antemortem wound. Antemortem wound, they are characterized by vital reaction. But here there is no mentioning of vital reaction or some other finding. Postmortem wound? No. The answer should be defense wound. So defense wound can be two types. Can be either active defense wound, it can be passive defense wound. Very important topic. Active defense wound, they are commonly seen over the palm or palmar surface or the ventral surface of the forearm. Ventral surface of forearm. So when victim tries to grab the weapon in incised wound or in stab wound, he tries to grab the weapon, you will see active defense over the interdigital space. Passive defense wound, they are commonly seen over the dorsal aspect of the hand and the forearm. And usually when victim try to protect himself, he try to protect himself from the wound like this he'll give. So this is known as passive defense wound. So the answer here is active defense wound is the correct answer. The A is the correct answer. Here you must know what are blunt force injuries, what are sharp force injuries. Blunt force injuries, what are blunt force injuries? Abrasion, bruise and laceration. Sharp force injury, stab wound and incised wound and chop wound. And also you must know firearm wounds. Very important topic. Entry wound, exit wound, ranges of different wounds in case of different range of rifle firearm or shotgun wounds, satellite wounds, also very commonly asked. You must go through that. A doctor sends a patient to diagnostic center. Question is about infamous conduct. Infamous means disgraceful, dishonorable conduct of a doctor. Next day, representative visits the doctor with a letter and money. So, doctor is taking some bribe or he is taking commission for referring patient. What is that known as? So, that is known as dichotomy conduct. Dichotomy. Dichotomy means P splitting. P splitting. Association with the non-qualified person is known as covering. Can be asked in your covering. What is covering? During treatment or during surgery or examination of patient, when you are allowing someone non-qualified, that is known as covering. Both are same. Criminal negligence, which is a gross negligence. Gross negligence. It was punishable under 304 AIPC. Was punishable, now it is not punishable. There is no criminal or there is no imprisonment for the doctors until the new amendment. 304A can be asked. So this entire scenario, that is nothing but infamous conduct. Infamous conduct. Let's see what is infamous conduct. Infamous conduct means dishonorable, disgraceful conduct of a doctor. I remember one very famous movie, Arjun Reddy. I've seen that movie, Arjun Reddy, Kabir Singh. So doctors who involved in many of the activities are known as infamous conduct. So they can be remembered with the help of mnemonic 6 A's. 6A, old mnemonic. Here is a picture, you can see here, doctor with alcohol. Doctor is doing surgery and he is at the at the party, he's having alcohol during doing the clinical examination or doing surgery. That can be remembered with help of mnemonic 6A. 6A, A for association with the unqualified person. That we discussed, it is also known as covering. And one more, here you must know dichotomy, we discussed already. A for association. A for advertisement. When doctor is involved in some repeated advertisement in TV, newspaper, especially for incurable diseases, using large signboard. So that can be infamous conduct. Adultery, when doctor is involved in sexual affairs with the patient, then it can be infamous conduct. Abortion, doctor involved in some abortion, therapeutic abortion without any indications, that it can be infamous conduct, that is comes under PCP Act also. Preconceptional, prenatal diagnostic techniques. Addiction, treating patient under the influence of alcohol, under the influence of some drug, like example ganja and heroin. Lastly, the alcohol. So 6 A's that can be asked. Infamous conduct of a doctor. What is the punishment? The punishment for infamous conduct is warning. Warning from State Medical Council and professional death sentence. Is proved there can be professional death sentence according to the rules of medical ethics given by National Medical Commission. And here let me discuss one question about criminal abortion. Criminal abortion. Criminal abortion punishment under 312 to 314 IPC. 314 IPC. 312 to 314 IPC. And here what you must know, MTP Act in detail. This is a very important topic. So all students go through this MTP Act in detail. Very commonly asked in your FMGE exam. MTP Act. Indications, number of doctors required in conducting MTP, qualification, the punishment, all these are very commonly. Now we are discussing around 10 to 15 questions of toxicology. Toxicology. Now question number 16. Yes. Question number 16 about the gastric lavas. Gastric lavas can be performed in case of poisoning by. So, this is the answer. Try gastric lavas. So, in the picture, what you can see here is the gastric lavas tube, known as Ewald's tube or Bohr's tube, Bohr's tube, Grieving tube, the gastric lavas tube. Gastric lavas, we are passing a tube into the stomach to do the aspiration. So gastric lavas is contraindicated in corrosive poison. So sulfuric acid is contraindicated. Strychnine is a relative contraindication for gastric lavas. The spinal poison causes convulsions. Convulsions is a contraindication for gastric lavas because of risk of aspiration. Kerosene oil. In kerosene is also relative contraindication for gastric lavas, because when kerosene aspirated into the lungs, it can lead to chemical pneumonitis, which is one of the serious complications of kerosene poisoning. So answer is C is the correct answer. C is the correct answer. C is the correct answer. Okay. So let me discuss once again. Gastric lavas is contraindicated in all the corrosives except carbolic acid. Remember this one. Strychnine is a spinal poison. Spinal poison. Kerosene can cause chemical pneumonitis. Now, question number 17. Which of the following poison can be found even in skeletal remains of the body? Skeletal remains of the body. Options are arsenic, carbon monoxide, hydrogen sulfide, and phosphor. What would be the best answer? Best answer. Try. All of you try. 𝐒𝐿𝐿, KK, Swapna, Anil Thanan, Music mantra, Dhananjay Kumar. They try this. So, must be heavy metal poison. Answer is arsenic is the correct. Arsenic. Not carbon monoxide, not hydrogen sulfide, not phosphorus. Heavy metal is the correct answer. So, arsenic is one very commonly as topic in. Arsenic is known as king of all poisons. One of the ideal homicidal agent because arsenic trioxide is a colorless, odorless, tasteless compound can mix with any food and drink, which can lead to some signs and symptoms resemble like cholera. Arsenic trioxide is one of the most poisonous agents. Fatal dosage around 200 milligram. It affects the many metabolic pathways, especially the enzymes known as pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase. So when all these enzymes are inhibited, it can lead to cancers, can lead to chemical carcinogenesis. The signs and symptoms and MCQ can be remembered with the help of mnemonic Bonaparte. So Bonaparte is the very famous king. He was killed by his servant by mixing arsenic with his food and drink regularly. So colorless, tasteless compound was unnoticed. So chronic arsenic poison leading to many complications and he died. Later, his hair and nails were preserved. During examination of hair and nails of the Napoleon Bonaparte, they found high amount of arsenic in his hair and nails. So that's why the mnemonic that is kept as Bonaparte. B for, so something is B in arsenic poison, B for black food disease. Black food disease. You know what happens in arsenic poison? Because of the vasculitis can be gangrene. A gangrene characterized by black color discoloration of the limbs, that is known as black food disease. This is asked in your exam. Forget to remember black food. One more MCQ here. Ball is the drug of choice. What is the drug of choice in ball? What is the drug of choice in case of arsenic poison? Your answer should be ball. British anti-levisite. Okay. It is a agent that is used in nerve agent. They found that it is also useful in arsenic poison. Ball. What is the drug of choice in arsenic poison? Ball is the correct. Black food disease characterized by black discoloration due to gangrene because of arsenic poison, because of the vasculitis. O for is to know a serious complication I said because of the oxide. What is the oxide here? Arsenic trioxide is the most toxic agent. Fatal dosage around 120 to 200 milligram. This can be asked. N for neoplastic lesions. Arsenic can lead to neoplastic skin lesions, or it can be lung cancer, can lead to bladder cancer, can lead to neuropathy also. The neuropathy, which is a mixed neuropathy. First point, arsenic poison, there is a mixed neuropathy. In lead poison, there is a pure motor neuropathy. Question can be asked. A for alopecia, anemia, Addison's leg disease. The clinical features resemble like Addison's disease. There can be anemia of chronic basis. There can be alopecia. Alopecia can be seen in various poison, including thallium poison. Then peripheral neuropathy. P for peripheral neuropathy, which is mixed. Aldrich-Mees line. So what are Aldrich-Mees line? Aldrich-Mees line are white color lines. Okay. The white color lines over the nails. They're known as Aldrich-Mees line. Remember, they can be seen in thallium poison also. Thallium poison. Then R for raindrop pigmentation. One of the very specific finding in case of arsenic poison. One more R, the mnemonic in case of arsenic. Rigor mortis lasts longer because of inhibition of enzymes. It retards putrefaction because of inhibition of enzymes. There can be red velvety stomach, very commonly asked. Red velvety stomach is seen in arsenic poison. Okay. Leathery stomach is seen in carbolic acid poison. There can be multiple tests in arsenic poison. They are known as rinse test, Mars test, FMGE test. They are not used nowadays, but the question can be asked. Rinse test is used in arsenic. Mars test, arsenic. FMGE test, arsenic. Neutron activation analysis, also in case of arsenic. P for teratogenicity, E for enteritis and endocrine hemorrhages. See, arsenic causes enteritis. It causes rice watery stool. It can resemble like cholera. It is very commonly asked. The question can be asked, malaria resembling poison is. The answer. Malaria resembling poison, your answer should be metal fume fever, that is nothing but zinc. The question can be asked, Aldrich measline also seen in thallium poison. Final poison, strychnine poison. Tetanus resembling poison, strychnine poison. All this can be asked in your exam. So, arsenic fatal dosage 120 to 200 milligram. The drug of choice, your answer should be British anti-leviside. King of all poison, ideal homicidal agent. The mnemonic is Bonaparte. Many MCQs we discussed. Now the question about the smell. The patient was brought to the OPD with a greenish color skin, rotten egg smell poisoning. Poisoning could be rotten egg, very foul smelling. Rotten egg means foul smelling. So what is the condition? Can you guess? Options are OP poison, cyanide poison, phenol poison, hydrogen sulfide. All you try, all of you try this, try. See, smell and the color of postmortem hypostasis very commonly asked. Cyanide, cyanide is I remember the cyanide Malika case, a cyanide Mohan Kumar case, cases where many victims were murdered by mixing cyanide in their food or the capsule. So cyanide, the smell will be bitter almond smell. Bitter almond. Okay. Bitter almond, nothing but your cyanide. So it is not the answer. Phenol, nothing but carbolic acid. There will be phenolic smell. So the phenol characterized by 5 C's, 5 C's in phenol, 4C or 3C also, coma, constriction of pupil, carbonuria, mucronosis, all. So that is a CCC of the phenol. Then OP poison, there can be kerosene-like smell. Kerosene-like smell. So it is not the answer. OP poison, drug of choice is atropine. This can be asked. The answer should be hydrogen sulfide. So just to conclude, a different smell that very commonly asked, garlic smell. The answer should be arsenic and phosphorus poison. Phosphorus. One drop in case of cannabis. One drop in case of cannabis poison. Bitter almond in case of cyanide poison. And shoe polish smell that is seen in case of nitrobenzene poison. Dear students, all these are very commonly asked topic. Question can be straightforward question. Burnt drop smell is seen in. Your answer should be cannabis. So this you need to memorize. Very, very important. Now let's start with some important images that can be asked in your FMGE exam. You need to answer. So let's discuss some important MCQ around the image or the seeds. Look at this. So the question can be given, this image can be given, identify the poisonous fruit or the poisonous seeds present in the picture. Identify this. Yes, so this is what you can see in this picture. You can see multiple spiny projections. Multiple spiny projections are there, and the fruit is single, and the seeds are brown color, and they are of kidney shape. So what is the answer? So spiny projection, brown color, kidney shaped seeds leading to delirium. It's a deliriant. The answer should be datura. This is nothing but your datura plant or the datura seeds. Okay, it's a deliriant. Deliriant means the agent that leads to delirium. Delirium means confused state, disoriented state. So let's discuss some points about the datura poisoning, very commonly asked. Datura. What is the fatal dosage of datura? Your answer should be 100 seeds or 125 seeds. What is the fatal period? 24 hours. What is the toxic principle? Toxic principle will be hyoscine, hyoscyamine, traces of atropine. Let me write here. Hyoscine, hyoscyamine, and traces of atropine. So, in case of datura poison, there will be signs and symptoms resembling like atropine poisoning. So, mechanism similar to atropine poison. What is the drug of choice? Drug of choice is physostigmine. 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 So now here there is a mnemonic, very old mnemonic. Red as a beet, dry as a bone, blind as a bat, mad as a hatter, hot as a hare, full as a flask. It's a very old mnemonic. Red as a beet because of the vasodilation. There will be some clinical finding, resembling or they are matching with the mnemonic. Red as a beet because of the redness. They are dysphagia. There will be difficulty in drinking water, difficulty in taking food, dysphagia, difficulty. There can be dysarthria. Patients suffering from datura poison, there can be difficulty in speech. Dilatation of blood vessel, that is known as red as a beet. There can be diplopia and distension of bladder. Mnemonic, full as a flask. And mad as a hatter. Mad as a hatter. Hot as a hare. There can be dry, hot skin. So what happens actually in datura poison? Because of the stimulation of the heat center, as you know, heat is controlled by hypothalamus. Anterohypothalamus that controls the heat, posterior hypothalamus that controls the cold. So in datura poison, stimulation of the heat center that leads to dry, hot skin. Drunken gait. Sometimes what happens? Datura poisoning resemble like drunkenness. So drunkenness is a punishable offense. Datura, it is a poison that leads to drunkenness like state. There can be hallucinations, visual hallucination and auditory hallucination. What do you mean by hallucination? Perception without stimuli. Delirium. So patient will be having something known as irrelevant talking, that is known as muttering delirium. Our patient will be doing like this, will be doing like this. So this is known as imaginary, pulling imaginary threads from the fingers. That is known as carpologia. The question can be asked, carpologia seen in case of datura poisoning. Drowsiness. There can be dryness of the mouth. What is the treatment? Treatment is physostigmine. This is a very important topic, very commonly asked in your exam. Please try to remember. Red as a beet, dry as a bone, blind as a bat because of diplopia, mad as a hatter, hot as a hare, full as a flask. signs and symptoms of datura can be remembered with the help of 9D manifestation. Drug of choice is physostigmine. Next question. Look at this plant. Try to identify this poisonous plant containing poisonous seed. So here the plant consists of the fruit occurring in clusters. They are in clusters and the seeds are shiny. Seeds are shiny seeds and they are occurring in clusters. And it is one of the agent of bioterrorism. What is the agent? Identify. Anyone can identify? Identify. Yes. So this is nothing but your castor plant. This is the castor plant. The castor plant, nothing but Ricinus communis. Ricinus communis. The Ricinus communis, it inhibits the protein synthesis. It causes death of the person in 3 to 4 days. The question can be asked, what is the fatal period? 3 to 4 days. Fatal dosage, 10 seeds. It is the agent of bioterrorism. It can be used in high profile murders. Example, umbrella murder case. One very famous case, umbrella murder case. In that case, Ricinus communis was used as an agent. Okay. So remember, whenever image given, when fruits are in the clusters like this, clusters, and when seeds are shiny, your answer should be Ricinus communis or the castor plant. Okay. Next question is about the poisonous seed asked in your exam. So the question can be asked. So the image can be given like this. Okay, this is the image given. Identify the poisonous seeds. The seeds are circular, the central depression. They look like aloo chips. Okay, they look like a small aloo chips. What is the seed that is? I'm giving you clue. The seeds are acting on the spinal cord. They inhibit the glycine. They causes more and more excitation of the muscle. Signs and symptoms resemble like tetanus. So what is the seed? The answer should be 𝐒𝐿. 𝐒𝐿. 𝐒𝐿 is the plant name. The active principle, that is strychnine. It acts on the glycine present in the spinal cord. It inhibits the glycine. It causes unopposed contraction of the muscle. It leads to signs and symptoms like example Ricinus communis, opisthotonus, pleurostotonus. So all these signs and symptoms, they are resemble like tetanus. The question can be asked, what is the fatal dosage of 𝐒𝐿? The fatal dosage of 𝐒𝐿, your answer should be 1 seed. 1 seed. 1 seed is the fatal dosage. The treatment, your answer should be barbiturate. Second, I repeat, there are 5 important points. The seeds are of 𝐒𝐿 seeds. They are circular with a central depression. Second MCQ. The fatal dosage 1 seed. Mechanism, they act on the spinal cord, inhibit the glycine. Fourth MCQ, resemble like tetanus. Fifth MCQ, the treatment of choice is barbiturate. Okay, and they are bitter in taste. Question number 22. The question number 22, there are 2 images given. Both are poisonous seeds. Both are poisonous. And what you can see here, the A and the B can be asked in your FMGE exam. The image A, the color is black and red. Black and red. Very attractive color. So they are known as Rati seeds. So nothing but abrus precatoris. Is this abrus precatorius? Abrus precatorius. So it's a vegetable poison. It is used as a arrow poison. Also used as a cattle poison. So in exam, question can be asked, identify the seeds that are used as a cattle poison. Your answer should be abrus precatorius, known as rati poison. The fatal dosage is around 2 to 5 seeds. 2 to 5 seeds. And in the image B, what you can see here, there is a heart-shaped seeds are there, which are black or brown color, which is also used in artificial brews. The answer should be 𝐒𝐿𝐻𝐃𝐈𝐀𝐻 anacardium. Nothing but marking nut. This is nothing but your marking nut. So the question can be asked in your exam. Marking nut consists of 𝐒𝐿𝐻𝐃𝐈𝐀𝐻 anacardium. What is the active principle? Semicarpol, bilavanol. What is the medico-legal importance? Used in artificial brews, used in criminal abortion. So what they will do, they will prepare a paste of this 𝐒𝐿𝐻𝐃𝐈𝐀𝐻 anacardium. They inject into the uterus. They lead to uterine contraction, leading to criminal abortion. So these two are very commonly asked MCQ in your exam. So one is attractive color, abrus precatorius. Other one is the 𝐒𝐿𝐻𝐃𝐈𝐀𝐻 anacardium, known as marking nut. Now next one, next image. Identify. I'll give you 30-second time. You need to identify the plant given in the image and the medico legal importance. Try to identify. Try to identify this plant. Come on, try. Yes, try. Right. So here there is a plant that is used in abortion. It is also used in artificial brews. It has a white color flower, which is known as alba. Sometimes it can be pink color flower, known as gigantea. This plant is known as calotropis. So the question can be asked, what is the active principle? Calotropin, calatoxin, and gigotin. What is the medico-legal importance? It is used in criminal abortion. It is also used in artificial brews. Remember, active principle is gigatin, calotropin, and calatoxin. Active principle. Where it is used? It is used in artificial brews. And in case of abortion. Both are MCQ that can be asked in your exam. Now the question number 24. So there is a plant and also there are seeds. Need to identify this. Try this. Let's make it interactive. I'm giving you clue. This plant, you know, that consists of very poisonous agent. Consumption is a punishable offense according to NDPS Act. Narcotic drugs and psychotropic substances. So, and this poison leads to coma, respiratory depression, and meiotic pupil. So, your answer should be, it is the opium plant. Is this opium plant? What is the name of the plant? Papaver somniferum. What are the clinical features? Meiosis of the pupil, respiratory depression, and the coma. What is the treatment of opium poison? Naloxone, naltrexone. Right. Treatment is naloxone, naltrexone. and all these are opium seeds. Opium seeds. Opium seeds are non-poisonous. Opium seeds which are there, they are non-poisonous. Non-poisonous. Okay. Now, one more very important topic in toxicology, especially the preparations of cannabis. Now I am talking about cannabis. There are 5 preparations given in the picture. You need to identify all the 5. What is this? A, B, C and D and also E. Identify the preparations. Identify. Rahil Panda, Swapna, KK, Anil Thannan, Music Mantra, Dhananjay Kumar. Can you try this? Different preparations of cannabis. So cannabis is a deliriant. Consists of 9-tetrahydrocannabinol. Leads to hallucinations also. Leads to euphoria also. Increases your appetite. It can lead to some amount of addiction, some amount of dependence on cannabis. So the preparation A, that is nothing but your bang. This is the bang. The question can be asked in your exam. Bang is made up of. The bang is made up of 10 to 15% of cannabis principle. It is prepared from dried leaves or the fruit shoots. And this second preparation known as mazoon, what you can see in the picture, some sweet laddu you can see. So sweet prepared from the cannabis, that is known as mazoon. The third one, or the C, that is known as ganja, is used for smoking purpose, consists of around 10 to 25% of active principle. And the D, what you can see here, resinous exudate or resinous extract prepared from the cannabis, which is nothing but your charas. Charas, also known as hashish. Hashish. And this is nothing but your hashish oil or cannabis oil. There are 5 preparations of cannabis. It can be bhang, ganja, charas, hashish oil and the mazoon. So it can lead to euphoria, it can lead to erotic hallucination, it can lead to increased appetite, and chronic intake of this cannabis can lead to a psychiatric illness characterized by impulse to murder, that is known as run amok. Run amok. This is very commonly asked question. Run amok is caused by chronic addiction of. The answer should be cannabis. Question can be asked. Magnum symptom is seen in cocaine poison. Magnum symptom known as tactile hallucination is seen in cocaine poison. Both are very important MCQs. Okay. And in cannabis poison, no treatment required because it causes very mild dependence, very mild addiction. Usually of psychiatric dependence, not the physical dependence. Alcohol and the heroin are the opium that leads to very high clinically evident physical and psychiatric dependence. Question number 26. Question number 26. At this poisonous plant in forensic medicine, nothing but your root. Identify this root. Resemble like horseradish root. Horseradish root. It can lead to hippus. Can lead to hippus also. Hippus. Hippus means alternate constriction and dilation of the pupil. Like this. Alternate constriction and dilation of the pupil by this poison. What is this poison known as? It is also known as queen of all poison. Yes, dear students, what is this? So this is your aconite root. Okay, aconite root is a sweet poison. Sweet poison. Can be mixed with the pan, can be mixed with the any food, can be mixed with the curd and milk also. Aconite, and around 3 to 5 gram, that leads to death of the person. Person dies because of the cardiac arrhythmias. What is the cause of death? Ventricular fibrillation or the cardiac arrhythmias. Can be asked. Number 26. Now, there's one more cardiac poison which has a yellow color flower. Yellow color flower. This must be yellow oleander. Yellow oleander. Okay. Yellow oleander, it's a cardiac poison. So, it's nothing but Cerebera thivacea. Cerebera. Just to try to remember, there are 4 important cardiac poison. One is aconite, yellow oleander, white oleander, and also the nicotine. Nicotine is also cardiac poison. Cardiac poisons sometimes they ask you in your exam. Question number 27. In question number 27, there is a picture given. Patient suffering from hepatic necrosis. Patient is having some hepatic failure signs and symptoms. And also patient is having some important finding in the jaw. There is a necrosis of the mandible. What is this poison that leads to this type of condition? Can you guess? So what you can see in the picture, there are multiple sinuses, pus formation, necrosis. This is known as phossy jaw. Phossy jaw. And the phossy jaw caused by yellow phosphorus. Yellow phosphorus. Remember entrance point, red phosphorus is non-poisonous. Red phosphorus is not absorbed, it is non-poisonous. Only the yellow phosphorus is poisonous. It can lead to a syndrome known as smoking stool syndrome. Question asked in your exam. Smoking stool syndrome caused by yellow phosphorus. Can lead to hepatic failure. Liver is the largest organ affected by the phosphorus, hepatic failure and death of the person. So these 4 points you must. Point number 1, phossy jaw. Point number 2, yellow phosphorus leading to smoking stool syndrome, hepatic failure. Red phosphorus is non-poison. All these are commonly asked. Question number 28. In question number 28, there is an image given, and the image is a snake which is there. And in this snake, what you can see here, third supralabial. The third supralabial. What you can see here, third supralabial touches the eye and the nostril. See here, touches the eye as well as the nostril. What is this snake? Options are common crate, common cobra, Russell's viper, star-scaled viper. What is the answer? Try, and try all of you. Try this. Third supralabial touches the eye and the nostril. Comes under Elapidae. This is nothing but your common cobra. Common cobra. Let me discuss 5 points about common cobra. 5 points. So it is a Elapidae. It is neurotoxic. Point number 1 is neurotoxic snake. Point number 2, cause of neuroparalysis, respiratory paralysis and death. What is the cause of death? Respiratory paralysis. Respiratory paralysis. What is the earliest symptom? The answer should be ptosis. Yeah. And remember, there will be no hemotoxic symptom. No hemotoxic. Hemotoxicity or hemorrhagic manifestations are very common in viper bite. They are not present in case of common cobra bite. In common cobra bite, usually signs and symptoms appear within 30 minutes. Signs and symptoms they complete within 2 hours. So the treatment should be immediate. Treatment of choice, your answer should be anti-snake venom, ASV, polyvalent anti-snake venom. So also you must know about the common crate. Common crate also very commonly asked. which is also neurotoxic, and it resembles like stroke. Common create you must know. Viper very commonly asked. Russell's viper, Sarsfield viper. All these are very commonly asked topic. You must know in detail about it. So timing, remember, whenever question asked third supralabial between eye and nostril, your answer should be common cobra. Common crate, fourth infralabial is largest. Vipers are hemotoxic, Elapidae are neurotoxic, Hydropidae they are myotoxic. Treatment of choice, polyvalent anti-snake venom. Next. Now look at this med student and others, Rahil Panda and others. Look at this. There is an image given in the exam. Patient suffering from alopecia, and there are some white color lines over the nails. What is this poisoning? What is the finding? Also, there is a neuropathy. There is a neuropathy. There is a white lines. Also, there is alopecia, and psychiatric manifestations are manifestations involving CNS. What is this? Anyone can identify this? So the finding here, the finding is Aldrich-Mees line. This Aldrich-Mees line. Aldrich-Mees line, and the diagnosis is thallium poison. This thallium poison, correct answer. It can be arsenic also. It can be seen in arsenic poison also. It is a non-specific finding. The last one today. So we are discussing last question. So in the last question, we are having the image that is showing urine. The urine is of green colored urine. Green color urine. Patient suffering from certain poisoning. There is a green colored urine because of pyrocatechol derivative or hydroquinone derivative. What is the diagnosis? So try this. Try this. Try this. Green colored urine, whenever asked carbolyuria, your answer should be carbolic acid poison. Carbolic acid poisoning. So carbolic acid is a ultra important topic. Ultra important, very commonly asked. It is the super duper topic of the FMGE exam. Is carbolic acid. Carbolic acid, it's a systemic acid. It is nothing but phenol. Most of the disinfectant, they consist of phenol, Pressol, Dettol and all. They consist of some amount of carbolic acid. Disinfectant it is. So the systemic acid, it acts on systemic site, like example brain, it leads to coma, leads to some local symptoms also, leads to leathery stomach. The mnemonic is 10-20-3-4. 10-20-3-4, this is the mnemonic. 10-20 means the fatal dosage 10 to 20 ml. The fatal period 3 to 4 hours. 5C is the mnemonic, leads to CNS depression, leads to constricted pupil, leads to carbolyuria. Why carbolyuria? Hydroquinone and pyrocatechol derivative. Cartilage, there can be deposition, that is known as uchronosis. There can be corneal deposition. Stomach, when you see the stomach, example, this is the stomach. Stomach, there will be hardening of the stomach. There will be hardening of the stomach. This is known as leathery stomach. Leathery stomach. 2 MCQ. Leathery stomach is seen in carbolic acid. Red velvety stomach is seen in arsenic poison. So here one more MCQ, you can do gastric level. Gastric levers can be done. Gastric levers can be done in case of carbolic acid poisoning because of the hardening of the MCQ. Very, very important. And PCT, that is the proximal convoluted tubule, that leads to hemorrhagic nephritis. Hemorrhagic nephritis. Delayed putrefaction that can be seen. So the cause of death is either syncope, asphyxia due to edema glottis. When carbolic acid is consumed, that leads to edema of the glottis, that leads to asphyxia and death, or sometimes syncope and death, or other complications like septicemia and death, or systemic complication also can happen in case of carbolic acid. Treatment, the immediate treatment should be gastric lever. Gastric levers can be done in poisoning. Okay. So all these are very commonly asked. Let me discuss why MCQ in carbolic acid. Carbolic acid known as, fetal dosage 10 to 20 ml. Fetal period 3 to 4 hours. Symptoms 5 C's, uchronosis, corneal deposition, cartilage deposition, carbonuria, constriction. Stomach, leathery stomach. PCT, that is the proximal convoluted tubule, that shows nephritis. And there can be delayed putrefaction. Gastric levers can be done in case of carbolic. All these are the important question that can be asked in your exam. One more point here I need to cover. Poisons causing meiosis. What are the poisons causing meiosis? Meiosis means constriction of the pupil. One is carbolic acid, chloral hydrate, OP poison, morphine, barbiturates and nicotine. The mnemonic is comb is the mnemonic. C for carbolic acid, C for chloral hydrate, O for OP poison. OP poison will be constriction of the pupil. And morphine and muscarine and also nicotine and barbiturate. All this they cause meiosis of the pupil. Remember mydriasis. Mydriasis that is seen in case of datura poison. Also in case of cocaine poison. These two are very commonly asked. Very, very important topic that can be asked in your exam. Important topic. Mydriasis, dilation of the pupil, can be seen in datura poison and cocaine. Cocaine is also a very important topic. Cocaine characterized by Magnum symptoms, tactile hallucination, multiple scratch marks over the body. There is increased levels of epinephrine, norepinephrine. There can be euphoria, so white lady. All these are MCQ related to the cocaine. Cocaine, you must know. Formication, that is very commonly. So that completes the some 30 important topics with image based questions and also some important mnemonics discussed in last 2 hours. So with this, now I'll stop the class, and before that there is one important slide. You cannot change your future, but you can change your habits. Surely your habits will change your very important nice lines from great person. With this, I'll end the class. All the best for upcoming FMG exam. Go through all the high important yielding topic. Be confident you can do it.